Hello, I am Eli Adashi, Professor of Medical Science at Brown University and host of Medscape One-on-One. Joining me today is Dr. Stuart Altman, the Saul C. Chaikin Professor of National Health Policy at the Heller School for Social Policy and Management of Brandeis University. Welcome.
Well, thank you.
It's just delightful to have you with us today.
Well, it's really my pleasure.
With your permission, I would like to dedicate today's session to your recent book, the title of which, right in front of us here, is Power, Politics, and Universal Healthcare. For all practical purposes, a history of healthcare in the United States over the last 100 years. And in the interest of focus, perhaps we could, since we can't cover it all, perhaps look at what's been happening recently since, if nothing else, that has been very exciting.
Yes, it has been. And I've been privileged of having lived and been part of this history for at least 45 years. And as I look at the current environment under President Obama and the whole debate over healthcare reform, in many respects, people say, well, where did all this come from? I mean, how did we get here? Why is our system so complicated? And that's what prompted me and my co-author to write this book. Because really, where we are is where we've been. And if you go back in time, you will see that many of the pieces that are part of the current debate really go way back. What is a big surprise to a lot of people when they read the book is how much of the Obama plan, the current health reform, was put together under the Nixon administration in the early 1970s. Now, I was privileged to have worked for President Nixon during the time and was very much involved. And you could, if you put the Obama plan and the Nixon plan up against each other, I would say 80 to 85% is the same.
That is a very interesting point. Which brings me to perhaps the first question, which has to do with how the president actually planned this huge initiative that ended up in producing the Affordable Care Act.
Well, there's no question that without strong presidential leadership, we would never have passed it or never will pass it. I worked for Senator Obama during the campaign, and many people told him, stay away from health care. It is a loser. It's too complicated. There are too many forces against you. Why do it? And he was determined. He said, it is too important. I am going to make it a very important, if not the most important part of my new administration. And I'm willing to take it on. Now, I also worked for President Clinton during the transition. And he, too, took it on. But I think he made some pretty fundamental mistakes, which ultimately led to it not being passed. But there is no question that without strong presidential leadership, it would not have happened. But Obama had some important friends in the Congress to make it happen as well.
So if you were to try and summarize the ingredients which made it work this time around, what would you say those were?
Well, there's no question that you need a strong, unfortunately, I don't want to be too partisan, you need a strong democratically controlled Congress. Universal coverage is not the Republicans' issue. Although, as I said, it was Richard Nixon who really pushed forward. Now, that's a story in and of itself. Why an otherwise conservative president made it his issue. And even though I was there and lived it and If you really push me that hard, it's hard to explain. But for the most part, it's a Democratic issue. And we would not, for example, have passed Medicare in 1965 had Lyndon Johnson not had a strong majority. So that's very important. You also need to be savvy about this thing. Americans are not ready for a revolution. There are a lot of people who want a single payer system and simplify the system, make it fair. And I can understand that. I understand why they want that, but it's just not in the American character. So you need to be savvy. And one thing that comes as a big surprise to most people, when you talk to people, including I'm sure your colleague, people say, well, yes, we need universal coverage, but even more important, we need to control healthcare costs. And I say to people, you cannot do both of them together. You cannot, even though, sure, theoretically it makes sense, get a good system working together and stuff like that. If you do serious cost containment, you will turn a big group of supporters of universal coverage, doctors, hospitals, pharmaceutical companies, insurance companies, who might be your supporters into antagonists, which is what happened to Bill Clinton. President Obama didn't do that. So while people criticize the current health reform, that it doesn't control costs, I think it was very smart.
Inevitable. In this context, you make very clear mention of some deals that had to be in place for this to fly. Can you expand on that?
Well, President Obama made a commitment to the American people that this healthcare reform legislation would not cost the country anything. Easy to say, hard to do. Now, let me say a few things about that. First of all, it had to cover about 15% of our population, which amounts to, give or take, 50 million Americans.
Yes.
To do that is not cheap. But a lot of these people are either young, that don't need a lot of health care, or who are already getting health care. As you know, billions of dollars of free care are provided every year by our hospitals and our doctors. So it wasn't that this bill added that much to health care. Actually, the best estimates are it added only about 1 to 2%. It adds up to almost $100 billion a year, but health care is very expensive. But but when you add it all up, it still cost $1 trillion over 10 years to do this. And where was he going to get the $1 trillion? So what the Obama administration did is they went to each of the constituent groups, like the hospitals, and they said, you stand to gain upwards of $200 to $300 million a year, because now you're going to get your bills paid before you're providing free care. We want some of it back. And the hospitals agreed to give $160 billion over a period of time, 10 years. They went to the pharmaceutical industry and they said, you're going to get your prescriptions paid for. You're going to have people who, before they couldn't afford it, we want from you, and they gave certain back. They went to the insurance industry and they said, we're going to mandate that everybody has to have health insurance. You stand to gain a fortune, but we don't like the things you're doing, like denying people coverage because they have pre-existing conditions. We're going to wipe those out, and in addition, we want additional money. And the insurance industry, obviously not pleased with every aspect of the bill, still supported it. What's most important, no healthcare group opposed this legislation. With all due respect, the American Medical Association, which has not been a big fan of universal coverage, supported it and continue to support it. So yes, deals were cut, and it was mutually beneficial for the healthcare community and for the administration to cut those deals.
That's very interesting. You also make special mention of Senators Baucus and Grassley, and then the so-called Gang of Six.
Yes.
Could you say something about how these actors influence the process and, for that matter, the outcome?
Well, yeah, I'd be glad to. you have to understand, well, I'm sure you do, the Congress. The Senate Finance Committee is a very key committee, and it is chaired by Senator Baucus from Montana, and he is what you would think of as a moderate liberal. He's a Democrat, but he is not ready to, turn over the whole healthcare system to the government. And he very much wanted a bipartisan bill. He has had a long tradition of working very closely with Senator Grassley, who was the Republican majority, and he hoped that he could forge a compromise bill. And the so-called Gang of Six was made up of 3 Democrats and 3 Republicans, and they tried to come up with a bipartisan bill. And Senator Grassley, who's known for compromising, made it very clear that he was not going to go it alone. They had to come up with a bill that would bring a number of other Republicans along. He was not going to be the total flag carrier, and he couldn't do it. The vast majority of the Republicans, from day one, for a variety of reasons, some of them very political, were not going to give Obama a win on this. And then they had strong philosophical differences. And so this Gang of Six, Committee of Six, worked very hard, but at the end, it took months, but at the end they just folded their tent, and Baucus had to go it alone.
Speaking of credit, sometimes probably underappreciated actually, is the role of Speaker Pelosi in the passage of the Affordable Care Act. What can you tell our viewers about her role in making this happen?
Well, I would say she was very important. She herself is I think, close to a single-payer person, and sort of represents the so-called liberal arm of the Democratic Party. But she had to recognize that in order to get this important legislation through, she was going to have to compromise her principles and put together a moderate bill, because in spite of the rhetoric, this is not socialism. This maintains a strong role for private insurance and private markets. It's a true compromise. So she agreed to do that. But I think her most important point, and where she deserves a lot of credit, as you remember, when our senator from Massachusetts, Senator Kennedy, Mr. Healthcare, unfortunately died at a critical time, and then, surprise of surprises, was replaced by a Republican, it looked like healthcare reform was dead, because there was no room on the Senate side for, they just had the 60 votes they needed in order to get this passed over what could have been a filibuster. And when it looked gloom and doom after the recess, there were few key people within the administration that went to the president and said, forget it. Maybe you should go for a little piece of legislation. You'll never get it through. Don't waste political capital. And she went to the president and said, no, we need to make this happen. We will figure out a way. And he agreed, and he went against some of his advisors. And the 2 of them and a few others pushed and came up with this strange animal in order to get it through, but they did. And so she deserves a lot of credit.
As key legislative achievements go, and I'm asking a professor here, what grade would you give the Affordable Care Act?
Well, the pragmatist in me, and someone who has been fighting this battle for 40 years, I would give it very high grades. Kind of like a B+, A-. If you back away and say, well, if you didn't have all the political fights and stuff like that. Could you design a better bill? Absolutely. But this is America. So if you said, I keep hearing these stories, oh, well, unfinished business, they didn't do cost containment, the bill, there are places where it's poorly written, there were pieces of it that are inconsistent with each other. Ironically, what most people don't realize, no one expected this bill to pass. The way the bills work, the Senate passes a bill, then the House passed a different bill, they then have a committee, and then they go and they rewrite it. But they couldn't do that given what I just said about the override. So they had to leave in place a bill written by the Senate which had a number of mistakes. So if you ask me technically, is what grade I would give it, probably would be C+. But in terms of politics and where we could be, I would give it a much higher grade.
Speaking of which, and I realize the imperfections of the process, which provisions would you have liked to see in the Affordable Care Act but did not? Cost control aside.
Well, as I said, I believed we could not do cost control. I liked it. While there's no cost control in it, there are a number of provisions that set in motion some very substantial revisions in the way our healthcare system is designed to operate. Now, they're done as pilots or demonstration. The Accountable Care Act, integrating healthcare, giving much more power to primary care physicians, recognizing medical homes. People need to know more. So what most people have been focusing on is the part dealing with the individual mandate, whether that's constitutional or not, the increase in Medicaid. But from health professionals' point of view, it's the second 1,000 pages that really matter a lot. There were parts of it that could be written differently, but I personally, maybe it was just my background and the fact that I've been doing this for so long, I didn't come away feeling that there could have been much difference in it. Everything was compromised. They had to deal with, hospitals that wanted certain things and physicians that wanted certain things. But, as I said, I'm a creature of our system. So from my point of view, I don't know if it could have been much better.
As we think ahead, it seems as if the next big road test is the hearing at the level of the Supreme Court. What scenarios should we consider in the wake of a Supreme Court decision? And obviously we have to consider two possible decisions. One which affirms the constitutionality of the individual mandate, and of course there are other issues such as Medicaid, and another one which does not. So take us to the best of your ability through those two roads that might follow.
Okay, so let me put it in pieces. The reason why the individual mandate is so important is that currently, and without it, many Americans, thousands of them, find that they cannot get health insurance. They have a pre-existing medical condition, sometimes from birth, sometimes from some condition that they develop through life. And insurance companies either will not insure people who they know are going to cost them much more than they're ever going to pay in premiums. So either they deny coverage altogether or they make them pay very high premiums that they can't afford. So the administration said to, and most Americans believe that's wrong. And the insurance companies say, okay, we will cover everybody. But if we do that, you have to have everybody covered. The thing the insurance industry fears the most is that millions of healthy individuals do not buy insurance until they need it. You know, you have this view. I have this view of somebody falling off the roof, and halfway down, their spouse gives them an insurance policy to sign. So it's a non-sustainable activity. So the individual mandate says to healthy, younger people mostly, look, you have to buy health insurance. Yes, you really don't need it today, but sometime in the future you will need it. And if we can smooth this out, then you do it now. And the insurance companies then get these healthy people in to counterbalance the sick people they're going to have to take. Mm-hmm. If the individual mandate is ruled unconstitutional, even the administration says you no longer can ask the insurance companies to insure everybody. Now, a lot of Americans are going to be unhappy with that. They think the individual mandates is no big deal, but it is a big deal. So those two things go together. The second question is, can we have the rest of healthcare reform without the individual mandate? And the answer is yes. It will not be as good. It will leave hundreds of thousands, if not more than several million Americans with no health insurance. But as I said before, there's a lot of other aspects of this that are very important, particularly for the healthcare delivery system. So what I most fear is that the Supreme Court not only will rule that it is unconstitutional, but essentially wipe out the whole law. Mm-hmm. If that happens, we are heading for a very serious problem. And many people in the healthcare community know it. We will have 75 million Americans with no health insurance. We will have hospitals being squeezed by regulation or by millions of people coming in with no care. It will not be a pleasant sight if we were to wipe this law off the books.
Mm-hmm. And one certainly comes away concluding that the big outcome, or the most significant outcome, would be really that we will not be able to provide close to universal health insurance, which was obviously a main goal of the bill. Granted, the Affordable Care Act could not, should not have dealt with controlling costs. That aside for the moment, what would be your recommendations to this or future administrations as to how to go about controlling the cost of health care, since that is not going away and is not being addressed by the Affordable Care Act?
All right, this is a tough issue. Let me start out by saying there is no magic pill. There also are no single or double villains here. If anything, the reason why our health care is so expensive, we all are part of the problem. Every doctors may make, if you compare us to other countries, physicians in this country make more than physicians in other countries. But I've come to believe that that's not the real. Yeah, sure, I always define people are rich if they make more money than I do. But, in and of itself, every country pays its physicians more. Well, it's a problem, but it's not a serious problem. We use much more expensive technology and much more of it than other countries, whether it's end-stage renal disease or MRIs or stuff like that. But surprisingly, most people don't realize we are less likely to go to the hospital than almost any country in the world. When we go into the hospital, we stay there a shorter period of time than almost any other country in the world. We have other things to do other than going to the doctor. We don't overuse a lot of aspects of the healthcare. So if you add up the overuse, quote unquote, and the underuse, use is not really the really driving force. What is driving is prices. And it's like marble cake. It's sort of intertwined in every aspect. Drugs are much more expensive here. Equipment is more expensive. Physicians, but everybody in healthcare makes more money. Nurses, accountants, lawyers, even us consultants. And getting at that is very hard. So the bottom line is we do need to slow the growth rate. Having the growth in healthcare growing at 2.5% faster than our income. When I started as a very young man, I will admit, in 1970, 71, we were spending $75 billion. It amounted to 7.5% of our GDP. Today we're spending $2.7 trillion, and it amounts to 17.5%. Now people say, well, they were saying then it was unsustainable. Now they're saying, oh, well, we can't grow any faster. The truth is we are going to grow faster because we want better health care. But we need to slow that growth rate. Now, my own view is we need to be careful that, yes, we should slow it, but we can't just wake up one morning and say, oh, healthcare should not grow at all, or healthcare should not grow by the cost of living. It can't happen. So my bottom line is we need a combination. We need to put some parts of the healthcare on a budget. Now you can do that either through government or through the private market. Both have pluses and minuses, but we can't continue to have it open-ended. It's a longer answer, but if you leave it open-ended, what's going to happen is parts of it, like Medicaid and Medicare, are going to be pushed down. Private insurance are going to be pushed up. More and more people won't be able to afford it. It's not. So we gotta slow the growth rate and keep that gap from getting out of line. Mm-hmm. It's not an easy thing to do. I've tried it. I've been a regulator and a marketeer for over 40 years, and I'll tell you, this country has tried everything, and at the end of the day, we have not had the political will. Mm. It's not that we don't have the technical will, but we don't have the political will to really do what it takes to really slow this.
So you really don't see us going under 17% of GDP anytime soon, if ever?
Absolutely.
Okay.
If we were to try that, we would have open rebellion, because what would happen is that Americans would find that they don't have the same access, mm-hmm. that all of a sudden the quality of care that they've come to expect would deteriorate. You would have open rebellion on the part of people that provide the care. Physicians would become, venture capitalists, which they are already. And no, I do not. And as a matter of fact, if you push me, I think we're probably going to get to 20% of GDP.
Next question, maybe hypothetical, but as a citizen of Massachusetts, what would healthcare be like under President Romney?
Well, if President Romney would only do what Governor Romney did, I wouldn't worry about it, because actually he deserves a lot of credit for what he did here in Massachusetts. We are very proud of our healthcare. I mean, overwhelmingly, Massachusetts people are very proud and like what happened here. In spite of what some newspapers and others would say, we have the lowest uninsured rate in the country. We are trying to grapple with slowing our growth rate in healthcare mm-hmm. costs. Mm-hmm. So in a funny sort of a way, and this may not be a politically correct answer, but if President Romney were to dismantle healthcare reform but leave Massachusetts alone, we'd be okay. It's the rest of the country that's going to be in bad shape. Ironically, what healthcare reform does is it brings the rest of the country closer to what exists here in Massachusetts. Mm-hmm. So, first of all, I who knows what would happen, but I really think if we ever Romney would ever to become president, he would never do the things he says he's going to do, because he would find that in spite of the rhetoric, a lot of Americans do not want to go back to an environment that totally existed before the debate. Mm-hmm.
On a personal note, if I may, you're a graduate of UCLA.
Yes.
How did you gravitate to healthcare policy, healthcare economics? You didn't quite start this way, did you?
No. You know, I laugh because, some people plan their life and it works the way the plan goes. And I'm sure many physicians are like that. From very young age, they want to be a physician. They work hard. They take science and so on and so forth. Maybe you were like that. My life didn't evolve that way at all. I grew up in New York, and I became interested in finance. I tell people at 16 I worked for a Wall Street firm, and I got interested in finance. And I thought I was going to go into accounting and finance. And then I got under the wing of a very almost a charismatic professor who taught me about general economics. I went to UCLA to become a person involved in what we call human resources. And I wrote my dissertation on unemployed married women, of all things. I want to take a little credit for the fact that I anticipated in the early 1960s that women were here to stay when it comes to the labor market. Anyway, then crazy things happened. I wound up in the Pentagon working on an all-volunteer military during President Johnson. And I met a group of people who then went to HEW, and they asked me to do a study about the supply of nurses.
So this was then health education and
welfare. This was
yes.
before HHS. Mm-hmm. And I wrote a book on supply of nurses, and then fluke of flukes, I wound up, as I said, in the Nixon administration, and having a very high position in that administration during the early 1970s, when government was a real force in healthcare. The HMO Act, we doubled the number of training slots for physicians. We tried to regulate healthcare costs. We set up planning agencies, and it gave me a ringside seat in almost every aspect of healthcare. And once I got into healthcare, I was hooked, and I've been part of it ever since.
Thank you.
It's my pleasure.
On this note, sincere thanks to Dr. Altman and to you, our viewers, for joining Medscape One-on-One. Until next time, I am Adashi.